Hi, I'm Dr. Cecilia Martino, Naturopathic doctor at Willow Wellness Clinic in Waterloo. I want to talk about energy. So, if you don't have energy, you really can't do much. You have a hard time doing your daily activities, going to work, taking care of your family, and so energy is really important. And there are many things that can cause us to have low energy, to be really fatigued. And those are things that I look at when I have a patient come in, and that is one of their chief concerns. So, what do I look at? I look at your blood work because your blood will tell me a lot about what is going on inside. So, one of the things that I encourage you to get tested for is your iron levels. So, low iron will cause low energy. That is because iron is necessary to bind oxygen, to oxygenate your body. And so if you are a female and you have low iron, because you are menstruating every month, we want to mitigate that and make sure that you have enough iron to give you that energy. Another cause of low energy could be B12 levels being low. And when you have low B12 levels, or if you have a genetic mutation that requires you to have more B12, you are going to feel fatigued. And so that is another area that I look at. I also look at thyroid function. If your thyroid is not working optimally, your thyroid is your gland here located in your throat. And if it's not working optimally, then what's going to happen is your cells are not going to get the message to consume energy. They're sort of their metabolic rate and get you to have more of that energy. And so if your thyroid's not working optimally, you're going to feel more tired. You're going to have difficulties losing weight. You may be losing your hair. You may be constipated, and all of those things I look at to see, well, what's going on with your thyroid? Is it working well? And so I look at blood work for that. Oftentimes they only test TSH, which is thyroid stimulating hormone. That only tells us a little bit of the picture. It doesn't tell us the whole story. I encourage you to get tested for free T3, free T4, and any thyroid antibodies. And these are all things that I go through in great detail with my patients if they don't already have those results. And as a naturopathic doctor, I can send you to get that tested if your family physician is not going to test you for those. And so we would look at balancing out your thyroid. That can usually be a nutrient deficiency. It could be iodine, it could be selenium, it could be zinc. And then stress. Stress is a big factor that can affect our energy levels and can affect our thyroid function. If we have a lot of stress in our life, and maybe we don't realize that we have a lot of stress, maybe we think we have everything under control, but our body is going to express itself even if we don't acknowledge it. And so we would look at your thyroid health by doing a urine test or a salivary cortisol test, or looking at your pupil reaction to the light. And these are all strategies that I use to see, well, are you adrenally fatigued? What's going on with your adrenals? These glands that are located above the kidneys make our stress hormone, our cortisol, and we need that for survival. But if we have long-term stress, then they'll just give up and say, you know what, I've had enough, and now we are more in the burnout stage. And so we want to prevent that, we want to treat that, we want to make sure that you are feeling optimal. And so these are the big areas that I look at when someone tells me that they're just feeling really tired. There are other reasons for being fatigued, but those are probably the most common ones. So if you are feeling tired, if you're not feeling optimal, if you're unable to get all your tasks done through the day, if you feel like you're overwhelmed and overworked, come in. We've got lots of strategy solutions, whether it's nutrition, whether it's counseling, whether it's relaxation techniques and deep breathing, energy work. All of those things can really help bring you back to balance. And of course, correcting any deficiencies that you may have, whether it's iron, B12, all of those, or mineral deficiencies, etc. So I do encourage you to come in, or whether it's myself or another naturopathic doctor, because this is what we love to treat and do. And a lot of it's going to be education. So if anything, you're going to learn a little bit more about your body. If you have any questions, visit my website, willowwellnessclinic.com. Thanks.